Welcome everybody. And after this webinar is over, I'm going to send you a letter, sort of a note letter, and it's going to have links into some of the critical documents we're going to talk about. And also I'm going to send you a video of the webinar. So what we're going to talk about today is how to actually prevent active shooters. So I have been talking about preventing active shooters for the last 15 or 20 years. I live right across the street from Parkland, from Marjorie Stoneman Douglas High School. And part of my family was in the elementary school right across the street and I was here during the whole horrible thing that happened. And it's been brought up again now because they took all the jurors who were in this trial. They took them over there at that 3-story building where all this happened. It's been locked up since the day of the shooting. They never opened it again. It took them this long to get money to be able to take the building down, destroy it. But the people who went there said it was horrible. Even the defense lawyer was crying in open court. They saw pools of dried blood, just everything just left like exactly like it was that day, except of course the bodies had been removed. So all this time I've been thinking, how can we do this? What can we do better? You know, when I do the webinars all the time, I send out the risk alerts, I talk to people and do training and drills and all this stuff. And what happens? It goes up. The number of people every single day goes up. Just drives me crazy. So the one thing I found that made a difference was to have concealed weapons screening. And the reason, and I appreciate that Athena Security is sponsoring this webinar today, but even if they weren't, and I didn't know who they were, I would be talking about whoever else was doing this, because it's incredible how it screens for weapons. So they've been telling me some of the stuff they've done. One of the things that they did was they put it in a place in a I think it was in a casino, and they started finding weapons like right away. It's like unbelievable how many. In fact, the former CEO of Cleveland Clinic, he put this kind of a system in his 3 hospitals in Northern Ohio. They had 30,000 weapons the first month, 30,000 knives and guns. And they tell me, the installers tell me, when they go out and put this in place, they turn it on. Usually they have a gun within an hour of any time. So that tells me we're not doing something right. You know, I mean, it's great to have policies and procedures and everything, but I finally got it. You know, we're not stopping. The rate of these things is still going up. We're not stopping anything. You know, we're just publicizing it more, almost like, anyway, don't get me started. Okay, here I am. Some of you know me, some of you haven't. If you don't know me and you're going to be in the IAHSS regional conference down in North Carolina at the end of August, you can come visit me there. If you're going to be in at GSX as is conference in September, see me there. And you can also write me and call me. And I've been doing this for a long time. I actually introduced the whole CMS program in Florida for healthcare organizations. And I know a lot of you are in healthcare organizations. And I've developed risk standards all over the world in here, but even in the Middle East and Asia and Hong Kong before it got too terrible, and all 50 states. So I'm really, this is my life's work. So I'm really interested in it. And this is what the CEOs tell me. This is the number one issue that keeps people up at night, is the fear of having an active shooter at work. And what that would mean for just like it ruined Parkland's reputation when it happened here, the city takes on, their name now becomes part of a link to shooting. If you did like one of those things where you say, what do you think of when I say Parkland? Well, before it was like in the top 5% of the best places to live. You know, now they think of shooter is the next word, and that's how they identify them. You know, the July 4th shooter, the Vestavia shooter, the Sandy Hook shooter, you know, just like that, your reputation of your town is ruined. And plus, of course, the impact it has on children and things like that. They also recently put out a domestic terrorism bulletin, a new one in June. June and July were really bad for shooters and things this year. And I made a link out of it. So you can go, when you get these slides, you can just click on that link, copy it, paste it, and then you can send it out. I would send it out to everybody in your organization, because when you read the thing, it's only like, I think 1.5 or 2 pages, but the places that they identified as likely targets are all the organizations that you guys represent. So it's a government, local government, it's hospitals, it's critical infrastructure, bridges, trains, all those kind of things. And it just keeps going on. And it's also racial groups, right? Like the top supermarket shooting where he picked the store that had the most Black customers and went there and killed 10 people. And those are the things that people are picking out. Religion, you'll see a lot of shootings in churches now. And I've been actually working with a faith-based group to put a workshop together that we're going to have in Virginia Beach, probably in September. And there are other groups that are calling now because they're actually afraid that they're going to get shot too. So it would do everybody a favor if you want to distribute this. I think it's a good thing to do. You can download it and read it first, but it's something that's really important. People need to be aware of it. This is from yesterday. So this is a Texas judge ordered Spectrum Cable and Charter Communications to pay $7 billion in damages to a family. And so what happened, their 83-year-old grandmother was brutally stabbed to death in her home by the cable installer. He'd been there the day before and he came back the next day because he saw how much money she had, came back the next day in his uniform again and said, oh, I just wanted to check on something. Went in the house, stabbed her to death, stole all her credit cards, debit cards, and went on a shopping spree. That happened in 2019, but the verdict was finally announced this week. And they found that Charter Communications, which is a parent company of Spectrum, was grossly negligent in the death. They cited systemic failures throughout the company. Prosecutors lied about his work history, but the Spectrum management never verified his employment records. So they didn't know the background he had. They didn't understand the red flags that pulled up. And not only that, but Spectrum charged the family $58 for the service call. And when it wasn't paid because the lady was dead, they sent it to a collection agency. So the jury, it was a jury trial. They awarded the family $375 million in compensatory damages and said that Charter has to pay 90% of that. Earlier in the week, a judge announced that Charter must pay an additional $7 million punitive damages to the family. And he said this verdict reflects the extensive evidence regarding the nature of the harm caused by Charter Spectrum's gross negligence and reckless misconduct. For the safety of the American people, we can only hope that Charter Spectrum and its shareholders are listening. And again, because this is a huge deal, because these people come in your home all the time. But what the whole point of this is that it's not about having to go on probation or go on leave from your work or something. I mean, these lawsuits, everybody files a lawsuit now. Within 2 hours of the Uvalde shooting in Texas at the Robb Elementary School, they already had 5 lawsuits going. Because wrongful death lawsuits, 5 million, 10 million, 20 million, nothing. Never heard 7 billion. In fact, somebody called me last night and said, are you sure it's billion and not million? And no, it's actually $7 billion. So this is another sort of interesting little couplet of things together. So this is, if you haven't seen them, you should sign up for my risk alerts just by writing me a note. And if you come to the webinar, you can get it free. I send them out every week or every other week. Sometimes I send them out every day, depending on what's happening. This is outside of St. Louis. Bridgeton, Missouri is a suburb of St. Louis. And so what happened was a 30-year-old lady went into the hospital. She took out a knife out of her purse in the emergency room and started stabbing a nurse and a paramedic and was left with serious injuries at SSM Health DePaul Hospital. Nurses, and what's interesting about this is the nurses said, we've gone in there every month, our Nurses Association, and said they've completely ignored us. We wanted them to increase security. We wanted more security officers. We wanted a metal detector, concealed weapons metal detector, to prevent some of this workplace violence and attacks that are coming to healthcare workers, and even attacks on themselves. There was one where the guy took a staff member, a nurse, took his gun to work with him, and he was able to walk right in. Hey, how are you doing, Bill? Oh, it's great to see you. Because there was no detectors, and he went in and worked half his shift and killed himself in front of the patients and the doctors and the other nurses. So it's going on like every single day, every single week. So this lady was arrested. The lady who was in the lobby said that she saw the nurse being stabbed in the neck and the back. She said, I heard somebody say she had a knife, so I looked up and I saw this woman stabbing the nurse and everybody else, and people just rushed to her and pulled her off. But the interesting thing is they ask so often to go in and to get security guards and metal detectors, and they never did. Said this was 100% preventable, said one nurse. When you're working at DePaul, you're walking down the halls looking over your shoulder. And again, totally unnecessary. And the reason I found out about it a little earlier was because one of my other clients in New York State actually had one of the people from DePaul take a job at his hospital. And he had I interviewed him too, and that I'm going to have that story coming out that's shortly. But basically, that's what happened. So then fast forward a week later. So these people have been asking for 2 years for this, haven't gotten anything. And now all of a sudden, they decided to increase security in their emergency department 1 week after a nurse and a paramedic were stabbed. Brian Perkins, the spokesman for the hospital, said a security guard had also been contracted to be in the emergency department 24/7. The metal detector was also added, and it's a 6th hospital in St. Louis to add a concealed weapons metal detector in their emergency department. And 4 of those hospitals belong to the same health system. So in the statement, he said that the hospital had spent several months conducting an extensive system-wide evaluation of our physical environments, seeking input from team members, and as a result, improvements will be made to the entire system, including guards having more education and training, which I don't think is going to help very much, but whatever. Then I thought I would just show you this. This came out in May. This is active shooter incidents in the United States from 2020 to 2021. And it just shows you how all these things that we talk about, a lot of these things that we do, they don't help cut these numbers down. That's why we have to go back to the drawing board, I think, and I'm writing a white paper on it now, and start at the beginning. What do we have to do to bring down the number of deaths, wrongful deaths that are happening every single day? So this is just to show you, and I actually had a CEO who attended this webinar, and he came up and told me, he said, the thing that I said, what did you think about it? He said, well, the thing that really stuck with me was how many incidents there are. We weren't aware. So here in 2020, they had 40 incidents in 19 states. 2021, they had 61 incidents in 30 states. The casualties, they had 164 in 2020, 38 killed. And in 2021, it went up from 164 to 243 with 100 killed. That's 3 times the amount as 2020. Only 1 law enforcement officer killed in 2020, 2 in 2021. 11 law enforcement officers wounded in 2020, only 5 in 2021. How many of these incidents met the definition for mass killing? 5 in 2020, 12 in 2021. Incidents where they targeted where law enforcement engaged the shooters in a gunfight, basically, 8 in 2020, 17 in 2021. And the gender, of course, was mostly male. In 2021, it was 60 male, 1 female. Again, the shooters did not really wear body armor. Who committed suicide? 7 in 2020, 11 in 2021. And what I found was that the older the shooter is, the more likely he is to commit suicide. So usually the shooters that are under 50, they raise their hands and they go willingly. But the ones who are older than that, they usually take themselves out. So that's just a little look at that. And I'm also sending you a link to this so you can see it. So why is this continuing to go on? Well, revenue problems, right? Hospitals use that as an excuse that they don't have the money to put in controls. And also, security controls are an expense item on a balance sheet. So who wants to put in, something that's not going to generate revenue, even though this is going to stop fines and things like that. So, it will be a revenue generator or liability reducer, I call it. They still have this idea it can't happen here. And using Uvalde as an example, since I have the 77-page report right here too, it can happen here. It can happen here. It can happen here tomorrow. And in fact, if it hasn't happened to you yet, especially if you're in healthcare, it doesn't mean it's never going to happen. It means it's more likely to happen. Because if the average is 1 incident a year and you haven't had one in 5 years, that averages are not on your side. A lot of older administrators, it sets their teeth on edge to think about having anything like this. and they just don't like it. They don't want to do it. And they're not aware of the new fines. They're not aware in healthcare of the CMS, the Centers for Medicaid and Medicare, that reimburses healthcare providers for almost 100% of the procedures that they do. And now they've changed the rules. It's 2016. Now you have to do the risk assessment. You have to do the emergency plan, and you have to have the threat analysis. They're not aware that it's a federal law now. And so same thing with OSHA. They're not aware of the fines, the damage, the liability, and these wrongful death lawsuits. The biggest one that we've had so far was $800 million, almost $1 billion. And that, of course, was the Mandalay Bay in Las Vegas. And these elements are required. They're not a choice, that you just get a choice about them. So, of course, in all workplace violence is going up in active shooters everywhere, but it occurs more frequently today than it did. And it said interventions are necessary to slow these rates so that healthcare workers can be safe and protected. And so, I have a list of 64 controls you should have if you're a hospital and 45 if you're a regular business. And like nobody cares that they're barely doing them. But even if they do every single one of them, it's not going to help unless they put in the metal detectors. It just doesn't find enough of the weapons. And in fact, I worked at a county in North Carolina in the criminal justice facility, the big building courthouse, and they had to go in, the people on probation had to go in and speak to their probation officer. And so what they did was they took their knives out of their pocket and flipped them into the hedges at the front of the building. And we went out one day after a month and we had 75 knives. And they would go out and get them to use them as the clerical staff use them as paper openers. So how common is it to healthcare workers to be hurt? It is more dangerous to be a healthcare worker, a nurse, or anybody than working on a high-rise building. So that's how bad it is. 7 of 10 physicians said violence in emergency departments increasing, and it's affecting patient care. So why, after all this time, if I've been doing this for 15 years, why is this still happening? After everything we've talked about and done, I still think that security is an afterthought for most people. They're more excited about their patient levels and the new technology and things like that. They don't care. The other thing, again, it's a balance sheet expense item. And so, they don't want to add any expense items, especially if, some of the things are changing and it's getting, of course, as more people get killed and stabbed in a hospital, it's harder to get people who want to work in a hospital. So that's another issue. And also security still follows this law enforcement model, which is you find the perpetrator and then you put him into the criminal justice system, and that's not what's happening now. If you look around, that's exactly not what's happening here. It doesn't really work for the kind of security, the corporate kind of security that we're talking about here. Also, there's still this artificial, and I know everybody's tried a million things to bridge this gap, but between physical security and technology. So what happens is tech isn't embedded in all these products. Some of them it is. And that's why that Athena concealed weapons detector, that's why it's the only one that meets the federal standard for metal detection, because it has the artificial intelligence built in. The company was built by artificial intelligence engineers. So again, we want to break down this bar between physical security. Physical security is as high tech as IT security. I mean, it really, really is. But people don't know it. They don't know how to work with it. And it's in some products, it's not embedded at all. So we're going to start. I'm just going to show you some things that are happening between May 15th and the end of June. So first one was the Geneva Presbyterian church shooting in Southern California. on May 15th. No access control, no weapons screening, just like you'd expect in a church. And this was a really small church. It had less than 100 members in the whole church. So any service it had about 43 members. So they would also, the shooter drove a couple hours to get there. He was Chinese national. He hated Taiwanese, and the population of this church was Taiwanese and American Taiwanese. So he took a nail, he took super glue first. He glued the church door shut. Then he took a nail gun that he brought with him full of nails, and he nailed the same door shut. And then he put a big chain on them with a deadbolt on it, and with a big lock on it, so that no way they could ever get those doors open. That was at the front of the church in the lobby. Then he went through the back door to get into the church, and he shot 10 senior citizens aged 75 to 90. And luckily there was a doctor there who his mother had asked him to give him a ride, so he did. And he hit the shooter with a chair, stopped him, but he was killed by the shooter. So again, why? Because the church members were Taiwanese. Then right after that, less than a week after that, we had the Uvalde school shooting, which we talked about a little more later. And we have a special webinar for schools on Thursdays, and that's when we do really go into this. Then right after that, the next week, we had the Tulsa shooting on June 2nd. And this was 4 victims killed. And this is on the St. Francis campus, which is a big campus. And this is the Natalie building, which is just one of the buildings in there. And so they had a guy named Michael Lewis who came in and killed people. And what he did was he had a real bad back injury. So he had an operation, and they told him that they weren't going to give him opioid pain relievers. So as soon as he got out, the next, I think it was like 5 days later, on May 24th, he went right from the hospital to the gun shop, and he purchased an AR style rifle from a local gun store. And he targeted his doctor who had operated on him, who was supposed to be the most competent doctor and very nice. He took that to the hospital along with a 40 caliber Smith & Wesson semi-automatic handgun he'd bought from an area pawn shop a couple of days later. And he just, because they had nothing, no control, access control, and it was not the main hospital, it was the medical building where the doctors had their offices adjacent to the hospital. So he was able to just walk right in, go up to the second floor, find the doctor up there and shoot him dead. And while he was up there, he also shot another orthopedic surgeon who was up there. He shot the receptionist and killed her as soon as he walked in the door. And then he also shot a bystander who watched. This is what the front of the Natalie Medical Building looked like that day. Here are all the different officers, federal, state, county, ATF, everybody right there. The next one is close to there. It's Encino Hospital Medical Center in Los Angeles. And this was a guy who didn't park his car. He drove up to the medical center in his car. He left it in the middle of the street. He had his dog on a leash, and he ran into the building, into the emergency room. And he got tired of waiting, so he stabbed a doctor and 2 nurses inside the hospital. While the SWAT team came in and negotiated with him after that for like 3 hours, trying to get him to give himself up. But he didn't. And he had just run in and asked him, said he needs some anti-anxiety medicine. And they said, well, you'll have to sit down and wait. And so that's when he started stabbing people. 3 victims were taken to an adjacent hospital that was a level 2 trauma center. One of them was in critical condition and underwent surgery, and they went to the Dignity Health Northridge Hospital Medical Center. And I do a lot of work with Dignity in California. So the guy had a lengthy criminal record, 2 arrests last year for battery at police office, resisting arrest. And there was an ultrasound technician in the lobby when all this went down. He saw the man with the dog, and he said he looked like he was high on drugs, that he was anxious, drenched in sweat. And the nurse had a lot of blood, been stabbed in the abdomen, a lot of pain, and so that's just another one so this was June 3rd, right? What could have prevented this? Obviously, they didn't have any screening to enter the building, right? He could just run right into the hospital with his dog, and nobody said a word, and he's sweating, and they had no panic alarms. They didn't have a receptionist duty. They didn't have a security officer present in the immediate area. They hadn't updated their policies and procedures. And they really couldn't have increased the police response because the police got there right away. As you can see, a whole bunch of them did, but didn't help. People still got killed. This is a week and a half later, the Texas woman starts shooting. So this lady in Conroy, Texas, which is an HCA hospital outside of Houston, she had to be picked up on a mental health hold because she was doing crazy stuff. So the ambulance went out to pick her up. They got her, they strapped her down to the gurney, her arms and legs. And then when she was wheeled into the hospital on the gurney, still strapped down, she managed to pull out her gun that I guess she had in her bra or something and started shooting. And after she fired a couple of shots, luckily the guy, one of the EMS guys, was able to reach down and disarm her. It was a lot easier since she was tied down to a gurney, but it just made me wonder, if you're going to put somebody on a gurney and strap them down, why wouldn't you check for a gun, or why wouldn't you ask them even if they had a gun? We had several other situations this year like that, including one in right near where I live in Florida, where there was a eye center where they do LASIK surgery, and this guy, they don't have to take off their pants, right? They just have to wear this little gown. And so he was completely anesthetized on the table, and all of a sudden they heard a clunk and a sound, and he had a gun in his pocket, and they moved him, adjusted him on the operating table a little bit, and his gun fell out and hit the floor and went off. Luckily, it didn't kill anybody, but it just shows you what can happen and why don't people ask? That's what I'm saying, is this is just like they said about Uvalde, systemic failures really on every level. So again, this lady was 65 years old, arrested and charged with 1 count of fatal felonies and 1 misdemeanor count of unlawfully carrying weapons in a prohibited location. So this is another reason why you need to have a sign on the front and back doors of your facility. When you can get a decal for, I think, $35, and you put the decal up and it says, weapons prohibited beyond this point, or say no weapons, or it can say, hospital is prohibited from accepting weapons or something. They have them, and you can buy them on Amazon, the little decals to put on the front and back doors. Why do you need that? Because when she comes back and tries to sue you for $1 million, and she says she didn't know it was prohibited, that's why she didn't say anything, you can say, no, the sign was right on the door. You went right in the door, and the sign's right there. So nobody can use that as an excuse. Here's another first, and this is also June. This is like 2 days later. This is a 71-year-old, the oldest active shooter ever, 71 years old, went to the Vestavia Hills Episcopal Church baby boomers potluck dinner in Alabama. He came, it was about 6 o'clock at night on a Thursday night. He got sit down at the table with some other people that he didn't know anybody there, and nobody knew who he was. And he ate, and then he took out his gun and started shooting, and he killed one of the people who'd been eating dinner with. Nobody had any knowledge of him or why he started shooting. The only thing we know was that he had a gun shop that he had to close because of he just couldn't make enough money. He shot 2 and injured 1, and the third person died almost immediately after that. So when we talk about security and safety, those are sort of squishy words that people aren't really sure what they mean. So I prefer to talk to people about compliance and liability. You have to be in compliance, or you're going to get all these fines and sanctions, and you have to reduce your liability, or you're going to continue to be hit with these wrongful death lawsuits. So one of the things that requires all this is the CMS, Centers for Medicaid and Medicare Final Rule on Emergency Preparedness. It's about 4 years old now, but also the OSHA General Duty Clause that requires employers to maintain a safe environment free of recognized threats. And that's why you have to have the risk assessment updated every year. So you can say, well, we've never had a flood here before, but in Kentucky this year on this river, we had a catastrophic flood and 45 people died. So you have to identify those things, whether it's a man-made event like a flood, like a shooting or stabbing or something like that, or whether it's an event like extreme heat. And of course, hospitals suffer, older people suffer a lot in extreme heat. So that's another thing you have to prepare for now. And then they just passed the new OSHA federal standard on workplace violence, which is they took out of this publication, OSHA 3148, that came out. This publication came out like, I think 2014 or 15. And they even say in the new bill that says it's going to take the same requirements as that were in here of how to prevent workplace violence for healthcare and social service workers. I'll send you a link to it. And this is, it had passed in the House last year, April of 2021. And a couple of weeks ago, it passed in the Senate again. And it became exactly the same name, Workplace Violence Prevention for Healthcare and Social Service Workers Act. And so it requires them to create the federal standard, to mandate this, so it's required even more than it was before. And of course, there are all sorts of state places that have, like Cal OSHA is like the OSHA for California, New Jersey OSHA. There are two states that do it right, and they have very strict workplace violence standards in those states, as well as now we have a federal standard. So what can you do to prevent this? So these are my main solutions that I would use now that I've become militarized or activated to actually do something about this. First thing is access control. So if you can't, in all these cases that I mentioned, every single one, nobody had to go use a back door. Nobody had to do anything. They just walked right in the front in the lobby. And what's a 50-year-old woman going to do sitting in the lobby if somebody comes in with an assault rifle? Nothing. So I think access control is critical. The enforced entry concealed weapon screening is absolutely required. And you get your money back the first year by preventing these weapons. And I'll say, you would be amazed at what people are bringing into your facility and you don't even know about it. Again, the most current policy and procedures, and there's got to be another way, a better way of getting these out to people, because in Uvalde, they didn't follow the procedures, the written procedures. And most of these, they didn't follow the procedures. Next one is secured doors and windows. So that's a huge, big deal. You can't have a secure facility if you have, no matter how much detection screening you have in the front, if people can walk in the back door because it's been propped open. So I've had a lot of, just in the last couple of months, I've had a lot of experience with propped open doors. I went to a big hospital in Los Angeles near a bunch of the movie studios. And I asked, can I go downstairs and get a cup of coffee? Which way's cafeteria? And they were like, oh, the cafeteria is closed for a week. Oh, why is it closed? And we had a rat infestation. And sure enough, the next night when I went out to do the lighting survey, I could see why they had a rat infestation. Because at 3 o'clock in the morning, they had 7 back doors to the hospital wide open, propped open, as a matter of fact. Everywhere I go, I find propped open doors, and it can even be management that's doing it. And especially people are on night shift and they don't want to walk out the front door and have to come back around. So they just prop the door open with a plastic box, usually, one of the, or a plastic bin, something like that. And then they sit out there and they have their cigarette and they go back in and they like the breeze, so they leave the door open. Well, the rats see that as a neon sign saying, please come in, food here for you. So the rats just take over the whole place, enough so it takes a whole week to eradicate them. And again, the security risk assessment is another huge part of this, because that's where you're going to get your threat information. The whole idea of doing it, I know people just do it to get it out of the way and they stick it on a shelf and they never look at it again. But the idea is, if we're having extensive changes in climate and rainfall patterns and hurricanes and all this stuff, you have to track them and say, is this something we need to worry about? And so that's just something that has to start to be getting done. And again, there's 17 kinds of healthcare organizations, so it's not just hospitals. I just noticed at my Publix grocery store here, there's a dialysis center down on the end of the same shopping little strip center. Dialysis centers right there. They have to do it. Behavioral health has to do it. Psychiatric hospitals, state hospitals have to do it. Everybody has to do it, basically, who has any kind of healthcare. And counties have to do it too, because counties provide certain kinds of healthcare on their premises in the county building. And one of them is, they didn't even know they were doing it, but they're giving pregnant women, they're giving them classes and checking their blood pressure and all this stuff. They're doing like little scans on them and also teaching them, how to be healthier. But that counts as a provider. And so that means they're getting reimbursed for the money they spend doing those checks on pregnancy. and so they have to get it from Medicare and Medicaid. Nobody's going to do it for free. And so that's why, that in here, I also mentioned the federal standard already. So let's just take a quick look at Uvalde. This is the Texas House of Representatives. This is the interim investigative committee, meaning we know that there's going to be another one. And I'll be happy to send you a link to this one too. Here's the link right here, Texas House Uvalde shooting report. And if you're reading it and you're bored, because it goes through every detail of where everybody was every minute. But so the last 7 pages, page 70 to 77, those are the ones where they have the recommendations and solutions. Here's the guy who lost his daughter, and he's holding that report in his hand. So again, Education Week has been tracking the shootings on the K-12 school properties that resulted in injuries or deaths. 20, not counting stabbings, 27 school shootings already this year, 119 school shootings since 2018. That was Parkland. Valentine's Day in 2018. Highest number of shootings, 34, happened last year. And there were 10 shootings in 2020 and 24 shootings each in 2018 and 19. And again, we talked about that already. These are some of the things that I used to routinely recommend, sort of not in a priority order, but more, these are the things that you have to do to click the box and meet the requirement. So now I'm thinking about prioritizing these things because they're not all created equal. So having an area of refuge, for example, that's a CMS requirement for healthcare organizations. Have a place where everybody knows they can go and hide if there's a shooter. And that's important, but it's not as important as having concealed weapons screening. It's just not. Same thing, disaster recovery plans, having cameras at work. At one of the hospitals I went to, they only had a third of the cameras that they were supposed to have because the wiring was bad in the hospital. It was so old that they couldn't attach the new cameras to the old wiring. So every time they lose a camera, they can't replace it. So they were down to like 15 cameras when they used to have 45. The notification systems, updating the emergency plan, doing better incident reporting, intrusion detection systems, all these things. And then we'd look at how often they occur and how much each control is implemented. So for example, metal screening, weapons detection. So I go to a lot of security officers' offices, and what I find is the same box up on the bookshelf. And it's a cardboard box that it's a wand detector, was shipped to them 2 years ago when they bought it. They've never used it. I can tell because it's never come out of the box. So that's not what we're talking about here. We're talking about actual screening of things. So again, Uvalde, they started out, first thing I heard about it on the news, they were saying, we're such a close-knit community, we could never have something like that. And then, 5 minutes later, they did. Again, they hadn't done any social media checking on this guy Ramos, who was a real bad actor. He shot his grandmother in the face and stole her truck in front of all the neighbors who were standing outside. Not one of them thought to call the police, the sheriff, or the school, because as he left, he said, I'm going to go to the school and shoot children. He said that, and nobody did anything. So this weird sort of inertia. The commander on the scene didn't get notified that the 911 calls were coming from the kids in the classroom. They all had cell phones. They were calling the police department. And nobody, the 436 policemen out in various titles outside didn't get notified that the kids were still alive inside. They didn't allow the first responders in. So a lot of the kids who died didn't have to. They bled out because they didn't go in soon enough. They didn't report on the shooter, even though he had a horrible record, and there's no accountability. So for all these things, we're going to have consequences, just like if you prop the door open and the rats are going to come in and cause, $200,000 worth of damage, you're going to get fined, or you're going to get door propping. You're going to get a fine. You're going to be suspended without pay for 3 months. There have to be consequences for these things. And again, here, the commander wasn't informed of the calls coming in. It was unclear who was in charge of the calls. It's a complete system failure. And he said that no single person or entity was fully to blame, but there was error at every single level. It's a continuing problem in healthcare. The violence is so bad. This is the Minnesota Nurses Association after they had a really violent event at Atlanta Hospital. couple weeks ago, or I'm sorry, a year ago. And on the day of the shooting, the nurses union had sent out a news release citing its own survey saying 95% of its nurses don't feel safe from violence at work. And again, it's even hard to get a restraining order because they're obtained by individuals, not by the healthcare organization. So in Minnesota has pretty good security, mostly for the most part, and even it says 95% of the nurses don't feel safe from violence at work. Also, drugs. So a lot of people go to get pain meds at hospitals. They used to have, I wasn't here for it, but they said that they used to have pain clinics all over here. And so, they stalk these doctors, they try to grab them when they go out of their car. And so there's got to be a better way. So I'm looking and I'm really exploring and looking at the value of having an access control concealed weapons screen detection program to keep guns and knives out of the hospital. Over 50% of hospitals and probably 80% of schools do no screening at all. So it's not a surprise. In fact, that was the thing with Parkland too. The guy came in, it was hot outside that day, so he didn't lock the back gates to the athletic fields, which was the first way to get in. And nobody locked the back doors to the whole facility, so that he got in through the fields, took a shortcut through there, walked right in the first door he saw on the backside of the classrooms tower and went right in. And that's what we see everywhere. People are just walking in through the back door, and the same thing happened at Uvalde. So going to show management. These are the kind of statistics you need to show management what the return on investment is on weapons screening. And so this is our standardized methodology built for high value critical assets. And it's also the only one that meets the federal standard for metal detecting, the Athena entryway product. So when we go to talk about return on investment, we have to walk through with the COO or COO, the cost of the control, how much it costs to maintain it, the value of the asset it's protecting, how likely the different threats are to occur, because we have a database with all the threats linked to the assets. So if this control and to the controls. So you say, okay, by this control, it's going to reduce rape by 10%, or is it 20%? And we have those numbers because we have all this federal FBI data on all these things down to the zip code. So we also look at the potential loss that would be suffered. So like in Oklahoma City, in the explosion there, a third of the building couldn't be rebuilt. So that was the potential loss that we use that as an example now, that a third of a facility, if it's blown up, 2/3 are able to be salvaged, 1/3 probably isn't if it's damaged or destroyed. So we can look at those and see how they would work for a controlled concealed weapons system. Get rid of that. Okay. So sorry. Okay. So first you have to do your annual security and safety risk assessment on each facility every year. It's required by CMS. It's required by OSHA now, as it's a federal law. Then you go through the active shooter security risk assessment parts. First, the threat data, identifying all the threat data, recognized threats, looking at the criticality of the assets. In any kind of a hospital healthcare is going to be, at least $4 to $8 million right off the top. So we have surveyed the staff to measure their compliance and awareness. So we had one company that had just put in $1 million training system and that only trained 5 people after a year. And why? Because they sent them emails and they never saw them. It's when you have a real dynamic thing like a trauma center hospital, people don't have time to read their emails, or they read them and they forget about them. So we have to go back and check and make sure that they understand what they're supposed to do in case of these emergency situations. Then we go through and look at how much these controls are implemented. Are they implemented only 10%? Are they implemented 90%? And if you spent $10, it'd be implemented to 100%. And then we prepare action reports based on return on investment, so a board member can understand exactly why you're spending that money. And it gets off that balance sheet problem. Then we update the emergency and incident plans, crime rates, look at all the lawsuits that have come that are, $27 million, $64 million for one person who was fired on the job in Philadelphia. in the Kraft Cracker Factory lawsuit where they make goldfish crackers. And she went right out to her truck and got her Glock and brought it back in. And the security people hid in the boiler room, and she went and shot the 3 people who had fired her. 2 of them died. 1 of them was paralyzed. And the lady who ran over the director of Lawrence Livermore Labs, who was doing sit-ups in Stanford University Health System, sued for $82 million by that woman's family and lost the lawsuit. This is when she stepped on the gas instead of the brake. Again, hospitals, nurses are taking the toll on this. That also affects your funding, your state funding, access to grants and things like that. And so having the assessment done properly protects you too, so you don't get sanctions and you don't get the monetary fines. So this is how we do the return on investment, but you can take a look at that. And this is how we create this continual cycle of improvement and where we get our threat data and how we average these numbers together. But let me just talk to you a little about the entryway system that sponsored this webinar. And so to me, I got it. Like, I was at this conference and they explained it to me and I got it. Like, why do you spend all this money on updating your policies and procedures that nobody does anyway, and they're subject to human error? You've got to get the human error part out of it. And so that's what this does, because it's an automated solution. So it maintains the highest possible traffic flow. So it doesn't block up and create a line like you do in the airport security, because it can do 3,000 to 4,000 people an hour. Can also use it to open and lock and unlock doors and turnstiles anywhere in your facility automatically. We've had a lot of situations where a shooter shot somebody in the parking lot, came in the hospital and shot more people, because their policy was, if there's a shooting in the vicinity on the campus, you lock the doors. They don't do it. You can tell them to do it. It could be a policy. They don't do it, and there's no accountability for it. They don't get in trouble. They don't get their hands slapped. They don't miss a day of work. They don't miss $1 of pay. It's just not right to do that like that. And again, how you could get a fast flow of traffic into facilities is it can see, because it's got the intelligence built into the system, it can see the difference between a weapon and a cell phone and a key and a knife and a watch and whatever. And so you don't have to take those things out, You can, in fact, I'm going to go ahead you just walk through these 2 posts. There's a camera, it's recording, it's analyzing all this data. You can go in, it detects more concealed weapons in any other system. And so these are the things that make this solution, better than the other ones, with they're only like 2 or 3 on the market. It's the only weapons detection system that meets a federal standard. And we're going to look at that federal standard in a minute. Has the highest accuracy of mass casualty targets. And they've been researching this. It's got the highest throughput, which is really the same thing. The lowest nuisance alarm rate. They get the least amount of false positives on this system, because the intelligence that's built into it is better. The sensors are better. You can use it standalone, or you can network it in with your network. It's got a silent mode available, so you don't have to hear a little ding when somebody walks through. It's not harmful to humans, pets, and other living things. It's not the dated airport technology. If you've ever seen the lady, she's sitting on a stool by the metal detector. You've put your whole life into this gray plastic box that she's now sifting through. She can see the x-ray of it, because it's an x-ray system. It's not what I'm talking about here. The x-ray system, it's looking at these things, but somebody has to manually go through them. And you may even have to, go down and get your luggage and open it up and show them that it's a hair curler. It's not a terrorist tool. And that's what we call the dated Air Force technology. It's 20 years out of date. So let's use the cutting edge technology to make it safest, best operational consistency, and also the most affordable. So they have really good prices on these things. And you're going to save, one lawsuit's going to be at least $2 million. And this is going to be so much less than that it really makes a lot of sense. It's also the only concealed weapon detection system that meets a federal standard. And this is the National Institute of Justice, Office of Justice Programs, 601.02. And that has all the information about this and how to detect this. And so here you can take the walk. We already looked at that. We can measure the state of all these controls in place, and then we can come up with our return on investment. What do they need? Do they need a security staff? Do they need a disaster recovery plan? You know, whatever it is, it's going to have a return on investment of like 8,000 to 1. So what we want to do is, I don't know if anybody here has seen that movie, Deja Vu, with Denzel Washington, and he plays an ATF agent, and they go back in time to try to stop this bombing in New Orleans, I think Algiers ferry dock. And he says, just once, I'd like to find something bad before it happens. You know, every day they send me out and I'm looking at what happened after it happens. Just once, I'd like to stop it before it happens. So that's what we're trying to do here, trying to analyze these things, trying to get management to sign on them, not just go down a list and check it off when you got it as a control, but actually pick the only control that's going to really help reduce death and injuries to your staff and to the customers, and the patients, and the children, and everybody, the teachers, all of them. It's just a better solution because it works. Doesn't depend on somebody coming in, somebody using the wrong door, having the back door open doesn't make any difference. Got to get people using this technology. And again, lack of security, a judge actually said this is not considered an effective legal argument after an active shooter event. So we want to analyze the current access control systems and the concealed weapon screening system. Usually even the access control to get into other facilities is not good. And I don't think I've been to one place where they had access control on every part. They'll have one building that they haven't done it yet, right? So it's like 80% complete. And again, starting with the risk assessment is the first thing you got to do so that you can do the return on investment. You can perform and analyze these threats that they're actually going to occur. And it also gives you the best bang for your buck, which is the best protection for the least amount of money. And that's what every board member wants to hear. You can write me for more information. You can just respond to my email that I'm going to send to you, Caroline Hamilton at riskandsecurityllc.com. And if you want to talk technical about the Athena security screening system, the entryway system, you can write to Michael Green, who's our CEO, Michael at athenasecurity.com. I'm actually a separate company, but I try to help companies because I have a mission in life, which is to save people from getting shot and killed. And since I drive by a reminder of it 4 times a day, you know, it's real top of mind for me. So I hope that you take a look at this. You can, they have the website, athenasecurity-security.com. You can go in there and see what webinars we're having right now. You can go and look at past webinars if you want to. If you're not a school but you want to hear the school webinar, you can go there and look at that. And we save them all on the website. And you can also call me. My phone number is 301-346-9055. Anytime if you have any kind of a question. And of course, you can email me too and email Michael. Thank you very much. It's Friday, so let's go out and celebrate that we're alive and things are hopefully going to get better soon. You know, why does this keep happening to us? And I want to make sure that it doesn't. So I hope that you'll take a look at this and work with me. And I hope you have a wonderful weekend too. And feel free to call me anytime. Bye-bye.